Hello, everybody. Welcome back to our WTF What's the Fertility Podcast session. So today we have someone special, which I managed to invite today, which is Dr. Lau Soon Yen, consultant fertility specialist at Genesis IVF and Women Specialist Center, joining us today. So before we begin, let me briefly introduce Dr. Lau. Dr. Lau has been practicing in ONG since 2005 with experience and training across Malaysia, the United Kingdom, and Singapore. He also received specialized training in fertility and reproductive medicine and has been with Genesis since 2017. Now, beyond fertility and IVF, his experience also covers women's health, laparoscopic surgery, pregnancy care, and childbirth. But today, we are not just here to talk about his medical expertise. We also want to get to know the doctor behind the white coat. Yeah, his journey, his experience, and some stories that he has collected along the way. It's been many years, Dr. Lau. So, welcome to the show, Dr. Lau.
Hi, thanks everybody for visiting our website. Okay, how are you all?
Okay, I think most of them are doing great out there. But thank you so much for joining us today, Dr. Lau. So, I think especially in Penang, Malaysia, or across Malaysia, they call you as Dr. Lau. So, is there any name that people used to call you that you might share to our people out there?
Well, my friend used to call me Lau. But nowadays, when people call me Dr. Lau, I probably say that I have another Dr. Lau in my home. And that means the doctor just graduated 3 years ago, also another Dr. Lau. So, but overall, I think just call me Lau or Dr. Lau will do.
Dr. Right? Lau. Okay, the famous Dr. Lau in Genesis IVF. Alright, so today we would like to ask questions that actually to get to know more about Dr. Lau and also including expertise and personal life experience in Genesis IVF and also his journey. So let's begin our first section. Dr. Lau, just answer all questions with your heart. Alright, no stress.
Must I?
Okay, so let's start from the beginning. The most common question, what inspired you to become a doctor, and was this something you already wanted to do when you were young?
Well, to start with, I think it's quite a difficult question because in my years when we are doing a study, we actually do not know what we want to do. I mean, they apply the same thing to youngsters nowadays. They're not sure what they do. But in the past, when they decided something, you must go on. Otherwise, your parents wouldn't be very happy about it.
What they call that, hit the wall first,
yeah,
right?
Something like that. So it started with I want to be an engineer.
Oh.
Yeah. I thought I would be good as an engineer.
Oh.
Right? But somehow my parents, mainly my mom, convinced me, probably you should become a doctor.
Probably.
Without asking why, she arranged for me to go for A-level in India. And then from there I go on, I got admitted into medical school.
Wow.
And well, here I am now after 40 years.
40 years?
Yes.
Wow. So across Singapore, the UK, and one is in Malaysia and India. So along the way, I think you have also experienced a lot of past life experience when you're in the medical school. But now you chose to become a doctor. But there were so many different specialties that you could have choose. Yeah. So out of the medical specialties available, what made you choose ONG?
Basically, I didn't choose ONG to start with. Well, my nature tell me that I should do something with a bit more handwork. So I want to become surgeon. Somehow I landed in the Teluk Intan hospital where they have no vacancy in the surgical department. And I was told to go ONG because ONG, you can take care of the woman, you can take care of most things, according to the medical superintendent then. Somehow I get stuck from there because my boss then refused to let me get out from ONG. He make sure I sit down and study and go for specializing in obs and gynae. And then just to mention that the teacher of me, he's actually the real starter for my ONG career. He just passed away 2 weeks ago.
Oh my God.
Right? Yeah. The name is Dr. Gill. I think that he's quite famous in whole Malaysia for his strict teaching.
Wow.
Yeah, very strict guy. Okay. But put that aside, I didn't choose to be ONG, but somehow later on, I find that ONG also quite interesting. In fact, most of the medical field are quite interesting. It depends if you want to put your heart into it or gain more knowledge into it. And I decided, okay, let's sit for exam. And after a few years, I passed the exam. And I decided to get a bit more experience somewhere else, like basically in UK. I spent about 4 years there.
4 years.
I meet a few good mentor teachers, and I improved from there. But that haven't described what I am now, because it's just all obs and gynae. Well, in the obs and gynae, just like most other field, you have a lot of what I call that sub-specializing.
Yes.
And again, I didn't want to become IVF specialist. I want to be an on-call surgeon.
Oh, that is so
or
different.
a laparoscopy surgery. But somehow, when I was invited to work in a Lamoille hospital, where the first private hospital I worked in, I was asked to join IVF because they need an IVF specialist. And it happened to be my boss then, Dr. Naden, introduced me to Singapore for IVF specializing. And that's how I start again. Yeah.
After how many years?
Well, basically, I graduated 1993 in medical school. And I started practicing in Malaysia 1 year later. And 1995 is the year I started joining obs and gynae.
Obs and gynae.
Yeah. But I didn't decide to go all the way until I finally graduated a few years later. 2003 or 2004, I can't remember that. Yeah. It's quite a long journey then.
Your journey, I can say your journey is kind of very unique, from want to be an engineer, from want to be an on-call surgery, and after that you will somehow become a fertility specialist. Which
That's
is
right.
Which is not in your plan actually.
Not exactly in my plan. So finally, I decided, don't go against the stream. Just go whatever it may come. That's why I listen to my wife more nowadays. She decide where to eat, I go where to eat. All right.
Okay, then you should thank to Mrs. Lau for shape how you are today, right? Yeah. Okay. So I mean, thank you for the so interesting sharing. And I think Dr. Lau, you listen to your mom as well. Yeah.
I do. I still
you
do.
listen to your mom as well. So that's why that is what you are today. I believe so. Yeah. Okay. Anyway, thank you for the sharing. So, but I have to ask you a question. If you were a fertility specialist today, what career do you think you would have chosen?
In medical field, you mean?
In anything. If you don't, I mean, maybe engineer, like what you mentioned just now, or anything else.
I think I still prefer to go back to engineering.
Engineer.
Yeah, recently, if you asked me a few years ago, I probably cannot answer you. But I will both go back to electronic engineering, because they're making big money nowadays. I think. I'm just kidding about it.
You are right, actually.
Yeah, but these are my basic understanding about them. But I might not be right.
Okay,
but,
so anyone that has looking for a career opportunity, listen to Dr. Lau.
Yeah.
Listen to Dr. Lau.
Career opportunity. I tell you what. A lot of people ask me, because since I'm a doctor, they ask me, is it good to be a doctor? I say that doctor is a field you gain a lot of knowledge, which you cannot learn from the WeChat. I mean, for all the GPT, ChatGPT on internet, right? But if you want to do medicine, make sure you're really having interest in it. Otherwise, don't try it. Yeah.
I agree with you, doctor.
It's a long journey anyway.
Thank you. And thank you for choosing to become a fertility specialist, which will really help so many people in this field. Yeah. So we're going to the second segment, which is the doctor behind the white coat. So we're going to dive into what you actually do. Right? So I think when people hear...
Nothing too personal, I hope.
So when people hear the word fertility specialist, the first thing that comes in mind is always IVF. So, but your role is actually involved more than that. If I'm correct, right? So could you share with us what actually falls under your role as an ONG and fertility specialist?
Okay. In my field, obs and gynae is a basic degree. Means you take care of a woman's fertility problem, delivery, and woman's problem like gynae surgery, that kind of thing. Then the field subspecializing in infertility stem out. Basically, most people understand it as IVF. But it just doesn't, just IVF. People have a bit wrong concept. You become IVF specialist, you just do IVF. No, you must be a kind of a all-rounder. You can do most thing, and then sub-specializing in IVF means to help people to understand their problem and to achieve the target of getting pregnant.
Yes.
Right? In a safe way. Yeah. So IVF, even though we say that IVF, we're just not doing IVF, there are many scope among in this field. Like you can do IUI, do an examination, you give advice. Now I kind of get away from doing too much surgery, if not infertility related. But I still do advice and tell them what need to be done. Yes. Right? Okay.
Okay. So also I find it quite special about the profession is that you can sometimes be there for almost the entire journey of a mom. From they can't be able to get pregnant to doing IVF to getting pregnant to the delivery. So you may meet the first couple when they're struggling to conceive, right? So you help them through the fertility treatment and you care for the mother pregnancy as you mentioned just now. So how does it feel when you get to see the entire journey come to life?
Okay. Another special thing I need to mention, in fact, initial part I quite rejecting doing IVF. Because IVF is not something that you can control very well with too many obstacles. And they need a lot of technology input and the result not always as you wish it to be. But recent years, I think I'm more happy than not because our success in IVF is getting much higher, right? As your question is how do I feel? Well, I feel more satisfied nowadays because our result improve. I can see a couple getting what they want to form a more complete family. Not say that without kids they're not complete, but for those who wish for it, we can help. We find satisfaction in there. Of course, we still help them until the delivery stage for the time being, right? Of course, some infertility specialists they do not continue the care until delivery because they're quite tight. I wish that I still can help them until the baby come out and say hello to the baby. Yeah. Okay.
Yeah. Okay. So that's a very positive moment that you have with your patient, but I'm sure you also will face a lot of disappointing moment, which you have seen a lot of stress in a couple. So when there's stress, disappointment, anxiety, how do you balance the emotional and medical side of your profession? Do you face any kind of this anxiety before when there's a failed pregnancy or failed IVF process?
Failing IVF process is the ultimate depressing moment for us, right? But as we understand that our chance getting better, we are getting much better result. Still, we have to prepare ourselves and prepare patient. Not everybody will get a chance to get pregnant. We just improve a chance. The decision is in the hand of God, I think, right? But we have to prepare ourselves well so that things might not go well. If there's anything else we can do better to make it successful for the couples, right? But not everybody can get pregnant, unfortunately. But fortunately, our results are getting much better. Yeah,
that's very good to hear, Dr. Lau. So, for people out there or any audiences that are listening to our Spotify right now, if you have any questions that you wish to know about Dr. Lau or you wish to know anything about fertility, you may drop us your questions in our social media or you may drop your questions in our WhatsApp and we will answer it accordingly. All right?
Yeah.
So, now, the last question for your expertise. So after all these years of experience, what do you think makes a great fertility doctor beyond medical knowledge and technical skills?
Okay. People come to you, they need to understand what is going on.
Yep.
The good achievement is you make them understand what can be done, what cannot be done, right? Not everybody must have a successful outcome. A lot of people just wish to know what's going on. They need to know their option. And in achieving that, help them to understand the situation and make decision. I think this is a good achievement. That's what I wish to continue on this achievement. Yeah.
Okay, I hope this achievement can be spread around all our patients in Genesis, and I hope Dr. Lau, you can help more people get pregnant.
I hope
with
so.
the technology you have now in Genesis.
Yeah.
Yeah. Okay. Thank you so much for the sharing. So now we are going to the third segment, which is more to fertility and IVF. So I've interviewed before a few doctors. I've interviewed before embryologists, nurses. So now we would like to hear from you, Dr. Lau. Okay, let's start from the basic. We hear the terms IVF all the time, but there are still many people don't really understand what happens during the process. Am I right, Dr. Lau?
Correct.
So for someone who absolutely have no idea about fertility treatment, how would you explain IVF in a simple term?
Okay. To achieve pregnancy, IVF technology and all the things we do is to maximize your chance.
Maximize the chance. Yes, that's a good word.
But of course, the certain cases, sometimes we just hope miracle happen. Well, everybody have a different chance.
Yeah.
Right? Well, for example, we always emphasize don't get too late, don't get too old. Because nature tells us it's time to rest, the body is time to pregnant, there's always a timing. So as the age going up, the chance getting low. So basically we said that we try to help them achieve a pregnancy with all the technology. Now, IVF is something to maximize the chance, right? How do we do it? We let patient understand every month on average you have one ovulation.
Yeah.
Sometimes you might not catch the time correctly, or sometimes the body don't listen to you. We take over all this process by injection, by the ultrasound, will tell you what's the best timing, and then we maximize by increase the chance of egg production, increase the chance of embryo formation, increase the chance of embryo survival outside the body, and increase the chance of the embryo eventually will grow inside your womb. That's what we are trying to do, increase your chance.
Yeah.
Yeah.
So I believe everyone's body is different. So you treat everyone differently as well.
Yeah.
Yeah. So in beyond all these fertility patients, I think the average age in Genesis will be above 35 years old.
Yeah, something like that.
What is your youngest patient that you treat?
My youngest, I think, is 24, 25 years old.
Wow, that's young.
Okay.
Very
it's
young.
something that, you see, things here and the things in Vietnam is different. For example, people there tend to get pregnant, married, and pregnant early. If they don't achieve pregnancy by late 20th, they panic. But our society is a bit different. They probably we focus a lot on work and career things, right?
Yes.
So we tend to have an older age marriage and conceiving time, right? And because of that, the chance is actually slowing down.
Yeah.
Right? And I mentioned that the age 20 something, people are getting smart. They know that I might not have a problem. But if I do try to get pregnant, if I worry, it's never wrong to get an early checkup. Let's say I happen to have a 20 something years old, she decided to come over because she feel that she is not ovulating correctly. And fortunately for her, we found that by scan, by blood test, her ovary is what we call aging fast.
In 24 years old?
24 years old, that's the one. Yeah. Aging fast, why? Why we do not know why. A lot of time we do not know why. Sometimes we blame it on medicine, sometimes you blame it on your age, sometimes you blame it on the food, but we never know why because everybody different.
Yeah.
So this case that happened to come early because she just want to check up after 2 years of marriage. She think that she should conceive early, but she didn't. So we found out that her age is aging fast. In order to catch a last opportunity, she proceed for IVF. And then she managed to save a few good embryo. Right? Not to mention what happened later. When you swipe a person, I probably she's listening now. Okay? So there is no right age group where you should need IVF treatment. It's good, always good to check when you try to conceive, but you're not successful after 1 year, it's good to check. Because sometimes you catch up on time, that's your lucky time, right?
Okay, but based on the conversation that we had just now, the patient actually realized she doesn't ovulate properly.
Because there's some changes in her menses pattern.
So I think that...
And she's been trying for 2 years.
2 years.
Yes.
So I think it goes to all the younger girls out there. If they know their body well, they know when they should be ovulating and properly monitoring their ovulating period, this might help them as well in the future.
Yes. The teaching nowadays is it's never wrong to come for early checkup before you decide how much time you give yourself for getting a pregnancy happen. Or even though you do not try to get pregnant yet, not wrong to check it out. Sometimes you might find out something unusual, you still catch the thing on time. Don't let the chance slip away. That's what I try and say.
Okay. So to all the younger girls out there, if you realize you are not ovulating properly, your period is not on time, I have some patients also come on period only after 6 months. Or if you have any pain during your period, please do have your checkup earlier if you are planning for a kid in the future. So don't ignore the pains. Listen to Dr. Lau.
Of course, this doesn't apply to a couple who actually getting married late. As I said, the ovary aging quite fast sometimes, right? Let's say I get married at the age of 36, 37. I do not want to wait for another 1 year. If I don't conceive within 6 months, why don't I check it? Because I don't have many fertile years to go. You know what I mean?
Yes.
So it depends on everybody.
Okay.
Right?
So if any couples there that just got married, this depends on your age as well. Do see a fertility specialist, as importantly, to check out your journey and see whether it actually challenge your planning in the future. Okay. Thank you so much. That's an interesting conversation which I think everyone should know. But I think there's some people out there still doesn't feel like asking for help when they have this kind of problem. They're afraid to take the first step, or sometimes they might worry the cost, emotional commitment, and etc. So what would you say to the couples who keep postponing the first consultation because they are afraid?
We cannot force people to do an early checkup, but we can give advice. Never wrong to check early. It doesn't cost much. It helps in the future planning. And then I'm quite happy nowadays. Most people understand it well. They do come forward, do a checkup, and go home and try on their own. If there is nothing unusual happen. Some people can do early planning. It's nothing very embarrassing or shameful about. It's just that you plan for your future. That's all.
Okay, thank you so much for highlighting that, Dr. Lau. And now we are going into the next segment, which is pregnancy and women's health. So let's go beyond fertility treatment, because you are also an ONG. So after all these years, what's still the most rewarding part of antenatal care for you?
Well, for me, I still do a checkup during pregnancy for my patient till the end of journey of giving birth. The journey accompanying them is actually, I think, a wonderful moment. I'm seeing that they're happy with the thing, and they can plan out their whole journey throughout the whole 9-10 months. And the best is that I can help them deliver the baby, but pass it back safely in their hand. I think it's a very good achievement. So you have been delivered. Do you count how many babies that you have delivered? I actually stopped counting. You stopped counting? Yeah, because I stopped counting because I think I already crossed more than 10,000 babies since years ago. So I stopped counting. That's a good achievement, Dr. Lau. I used to work in Lamoille where the working load is a bit high, but so far so good. And can I put it easily more than 12,000 now? Wow. I need to give you an applause of this. I give myself an applause then. Okay. Okay. Well, congratulations, Dr. Lau, for the achievement. And I hope you help more mothers. But then we need to also hear from you, from a doctor's perspective. What are some of the most common mistakes or misconceptions that you see among expectant mothers? Right. pregnancy itself actually quite a stressful situation because you endure with the psychological changes, physiological changes, the body keep changing. You're not as great as you used to be. You can't even run marathon now or not even run 100-meter now. So there are a lot of changes. Most people are actually quite happy with it because they adapt to it quite fast. Some people don't. But understand it's just a transition thing in life. You're growing with baby growing with you. Well, you're taking a big care of the baby when they're still inside, right? But people still taking certain thing as they have a misconception. They say, should I deliver normally? Should I deliver by C-section? My advice is that we will tell you who should deliver by C-section because there are always some indication. Let's say, for example, this baby having a head up position, we call it bridge, right? You can't deliver normal because nobody do a delivery by bridge. It's a bit risky. But beyond those indicated for C-section, another example is a low placenta. Anybody can try normal delivery, but do not force yourself to accept this method or the other method. People always ask me, Doc, which is a better method? Normal or C-section? A lot of time I tell them, you don't have to decide yet because you do not know what you want. Despite knowing that nowadays a lot of people try to, you can't really say that they choose the easy way out. It's a more trend for many good reasons nowadays. Unlike in the past, they choose to do a C-section. I cannot say it's right or wrong. And again, pregnancy by IVF doesn't mean that you must do a C-section. Understand? Women's body is great. They can always deliver. But for those who cannot deliver, we'll tell you upfront said that this should deliver by C-section. Other than that, don't worry too much. And they always worry something else like, what if I deliver in the middle of the night, it cannot come? So far, I always make it, right? But our system is quite complete. Let's say, for example, I get stuck. I cannot come to your rescue or cannot come and help you. My colleague will always happy to help out. My obs and gynae colleague, right?
Okay. So, may I ask? So you mentioned about the breech and how the baby position.
Yes.
What are the most complicated case you have during your delivery time in the hospital?
Most complicated. I mean the most emotionally demanding time is that when you a woman delivering a baby, and then towards the last part, that the heartbeat seems to be abnormal, give us a warning, you have to take the baby out, yet you think cannot, kind of rushing, is the adrenaline push time. That is a bit demanding. Or the baby head out, the body refuses to come out because it's a big baby. Right? Of course, your skill will help you out. I think touch wood so far, my complication risk is low. Nobody is complication free, but my complication risk is quite low. I'm quite happy about that.
Great to hear that, Dr. Lau. Okay, so we go to the next one that I really want everyone to hear about this. What's the one pregnancy myth you really wish everyone would stop believing? So people will come to you, Doctor, can I do this? Can I do that? Because I heard from someone else is this and that.
People always ask, what is the best thing I eat during pregnancy? My answer is that there's no such thing best. You just eat healthy food. Hopefully you don't fall sick during pregnancy. Don't get bad diarrhea in the first few months because eventually it can cause a bit of an unfortunate situation like miscarriage. Eat healthy food. Have good sleep, don't get too tense up. That's all I can tell, right? There's no such thing as a very good food or bad food. In fact, I think we are eating more of genetic modified food nowadays.
Yes.
But despite saying all these things, you cannot go and grow a fruit on your own, right?
True.
So just be relaxed.
Okay. Relax to all expected mothers. Relax and just be yourself. Anything you want, you can look for Dr. Lau, okay?
All right.
All
Hope to help.
Thank you so much. That's all about pregnancy and mothers. So now you would like to know about your personal reflections. All right? On yourself.
On myself?
As a doctor. Yeah.
Wow, this has suddenly become very personal, I think.
All right. So we talk about like all happy moments, your fertility journey, and I think we have to acknowledge that fertility medicine isn't always filled with happy endings lah. So there are difficult cases too, and sometimes despite everyone's best effort, the outcome isn't what the patient or doctor hope for, as we mentioned earlier just now. So how do you personally cope after a particularly difficult case like just now you mentioned, the heart rate drop?
Well, you do what you need to do. Make a quick, wise decision based on experience and evidence-based thing. Make it safe for everybody. I think that is why we say that obs and gynae experience come a lot and handful, and you help out a lot of situation, right?
Okay.
And if you're referring to IVF unsuccessful, we can't help that. We are just doing our best. Despite our best, still certain cases couldn't be successful. Then we have to reanalyze what gone wrong. Is there a chance to proceed further? We want to be very honest to patient, right? Tell them, can we do it again, or you try the best. That's it, Okay. Be honest. We always try to be honest.
Okay. And I'm sure that you also receive some meaningful messages from patients over the years.
Yeah.
So which one is the most meaningful thank yous or any beautiful messages that you receive from your patients? Just one.
Just once.
Or you want to share 10 also can.
I think a lot of moments are actually very touching. I can't recall what should I say. Probably one of the things is that I helped out one of my old friend to achieve 2 pregnancies, 2 girls.
Wow.
Yeah, no name mentioned. He's very happy about it. I extremely, despite I try to act cool in front of him, I always try to act cool, but I'm very happy for him that he has his children. Yeah, despite my kids went to university, his kid not even primary school.
Oh.
Yep.
Wow.
Okay. Yeah.
And thank you so much, Dr. Lau. All right. So, in all this happy moment, we would like to hear what has being a fertility doctor taught you about life or in life.
Life is amazing. Well, I believe we are actually the hand of God, and we learn the knowledge, we make it better for everybody. Well, every field, they do have their own purpose. My purpose is to help out to those who have a difficulty in getting pregnancy, make the goals achievable for them.
Nice.
Yeah, okay.
Yeah.
And particularly for the last few years, see, IVF will have progressing so well. Our success is getting better because of thanks to technology and the major team of embryologists and the whole clinic team, right? Things are getting better. Yeah.
I think experience made everything a good.
Experience from every part of the team is very important. Yeah.
Okay, thank you, Dr. Lau. That is the actually partly end of our conversation, but not yet. Okay. So, Dr. Lau, it's a very beautiful conversation we had just now. So this will be a very fun section, which we call the fire section. Okay, why fire?
Fun for you, man.
Yeah. It's fun for everyone of us here, just to get to know you more. Okay, so the rules are simple. You don't need to think too much. So, and any questions I ask you, you have to answer me the first thing that comes in mind. All right. So I'm gonna ask you around 5 to 6 questions. Are you ready, Dr. Lau?
Okay, I'll try my best.
All right. Ready? Right. One word your patients would use to describe you.
Approachable.
Approachable. All right, that's good. Coffee or tea?
Coffee, please.
Coffee. All right. Early morning or late night?
Late night.
Late night. You prefer late night?
Well,
Okay.
You asked me not to think.
Okay.
Yeah.
Okay. Favorite comfort food after a long day?
Oh, okay. My favorite food is北投鱿鱼, what you call it? 卤肉饭?
卤肉饭, Taiwan food.
Taiwan food.
Okay. All right. One thing you like to do when you're not being a doctor?
Watch movies. Badminton.
Badminton. Okay.
Yes.
Okay. All right. Most memorable baby name you've ever heard?
Most memorable. I can't recall any because most their names sound very comforting, very
Among the
nice
12,000 babies that you
Sophia.
delivered. Sophia?
Yeah, I like the name Sophia.
Okay, Sophia is a good name. Alright, if you could go back and give your younger self one piece of advice, what would it be?
Invest better in the share market earlier.
Okay, that's a good piece of advice. Alright, and one last one, being a fertility doctor is?
Sorry?
Being a fertility doctor is? Complete the sentence.
Achievement of my life.
Achievement of your life. Alright. Thank you so much, Dr. Lau.
Okay.
And I think that's a perfect way to end today's conversation. And thank you so much for joining us. And not only share about your expertise, but also to know you as
Thank you.
Dr. Lau Soon Yen, IVF specialist in Genesis IVF. Alright. So today we talked about a lot of things, but most of all, Doctor, we got to know you more. Right?
Okay.
And for anyone who is watching there and you think that today's conversation do help you, please do not hesitate to approach us or contact any one of us. We are more than happy to help you and your family as well. Alright? Okay, sometimes is taking the first step is most important, like what you mentioned, Dr. Lau. Asking the right question and know what are the options available to you. Alright? So, and this is the end of the session. Dr. Lau, thank you so much once again for joining us.
Okay.
Alright, and anyone, and to everyone out there, thank you for watching and thank you for listening. We're gonna see you the next round of WTF What's the Fertility podcast session. See you next time. Bye bye.